is Stroke Awareness Month, and there is a new way to educate people about the signs and symptoms of stroke. We have Dr. Olds, who is here. She is a neurologist at St. Luke's, and thanks so much for coming. Now, this is an important reason for coming because this is stroke. It happens to a lot of people. How prominent and common is having a stroke?
So somebody has a stroke almost every second, and we treat 1,200 a year here at the plaza alone. So it's very common, and therefore very important to know what signs and symptoms to look for and to get help quickly.
All right, let's talk about those symptoms.
So we've always taught FAST, stands for Face, Arm, Speech, Time. And we've added now American Heart, American Stroke Association, it's Be Fast. So we recognize that FAST didn't always capture all of the stroke symptoms, especially those that could happen from a stroke in the back part of the brain or the posterior circulation. So we do Be Fast now. So B stands for balance. Sudden onset of room spinning, vertigo, or feeling like things are moving around you can be a stroke symptom. E stands for eyes, and that can be loss of vision or double vision, and that can be a stroke symptom as well. And then F for face, facial droop, facial weakness, facial numbness. Arm for arm weakness, numbness. Speech, inability to get your words out or slurred speech can both be a stroke symptom. And then T is for time. That's very important. Call 911, get help immediately.
So this is something that both the patient, the person who's experiencing the symptoms, as well as someone who's observing someone experiencing these symptoms, that's something they can both look for and realize themselves and call.
Right, and we do it both ways. People get help themselves, or we have family members or friends. I have a lady today I saw who was driving a car and her friend recognized something wasn't right, and they were able to get help right away.
We really need to have stroke top of mind when we see someone really looking odd or being strange, and it's important timing-wise. Why?
Because we can intervene and try to reverse stroke symptoms. There's an IV clot buster called TPA that can be given up to 4.5 hours from symptom onset. And then large vessel strokes are managed in comprehensive stroke centers, and those are where a large vessel is blocked, and it requires a specially trained interventionalist to go up and try to get that blockage open. And that's very exciting to see done, and you'll see somebody that has big stroke symptoms, can't talk, can't move one side, and then you get the clot out and they look back to normal.
Boom.
And again, we can intervene several hours after a stroke if there's a large vessel occluded, but the sooner that you get help, the better folks do.
And this is important because once you have these irreversible symptoms, the irreversible results of a stroke, what are some of those? I know it's just probably the speech and kinds of things, but what do people suffer when they don't get help right away?
So if they don't get help right away, or if the stroke's not intervenable, they're left with deficits, maybe vision loss. I think most frustrating is when folks can't get their words out and communicate well. You just see the frustration in their eyes. Not being able to move one side of the body or the other, having trouble walking, getting back to what they love to do and living life to its fullest is hard to take away from someone. Rehabilitation specialists, physical, occupational speech therapists, physiatrists, they're wonderful in helping folks get back to what they love. But, it's even better if you can reverse the symptoms within a few hours and not go through all of that.
All right, good advice. Thanks so much for coming and for sharing. So remember, it is Stroke Awareness Month. Be fast. That's what you need to remember, and get to the hospital right away. Thanks for coming.
Thank you so much for having me.
Now.